take appropriate actions. Acute illness can occur in a patient with dementia, but they may not be either able or willing to let us know that they are in extreme pain or that they're experiencing other physical symptoms. So we have to be the ones to discover and track the patient's behavior, which is a clue to their feelings. Dehydration is also very common because people with dementia do forget to eat and drink. They are not aware many times of where the drinking fountain or the cafeteria or any other place may be where they can get either nourishment or refreshments. They will be reluctant to ask. They may even, in the mid to later stages of the diseases, actually need help with drinking and eating, and you will need to be aware of that. They do experience pain, as we all do. Arthritis is very common in many older patients. Headaches are very common with everyone, and yet a person with dementia may never think to say they have a headache. You may have to notice that they're sitting and holding their head or frowning or grimacing, and that would be a sign that perhaps they do have a headache. Depression is a very, very common phenomenon with the aging in general, with persons with dementia in particular. It often accompanies a dementia. It is very obvious that people in the early to middle stages of a dementia may very well feel depressed and may suffer from true clinical depression. In the mid to late stages of the disease, it may not appear that they are exhibiting symptoms of depression, but it can still be part of their feeling content even if they can't express it. Grief is another phenomenon that it affects all of us throughout our lives, especially for older people who often will have a dementia. They are suffering from grief and loss, but they are unable to either talk about it or even get in touch with their own feelings to be able to communicate that to you. Any sudden change in behavior can indicate a physical health change, unrelated to the dementia or related to the dementia, and it may require medical assessment.
Hello, my name is Veronica Nauman-Bugle, and I'm a Community Outreach Coordinator for the Alzheimer's Association. Environment is an important, yet adaptable, influence on behavior. It is flexible and changeable to suit the needs of a person with dementia. It is also often a challenge for those that need to be very creative to devise an approach and an appropriate environment with stimulating and calming elements. Stimulating elements such as music, the smell of fresh coffee, and activities and communication and people talking enhance a person with dementia's independence and quality of life. An active mind and body can foster a good night's sleep and also reduce restless behavior. Calming elements such as soft music and hand massages or neck massages are also necessary to allow a person with dementia's mind and body to rest and gather energy, because persons with dementia have a lower stress threshold. And people with dementia cannot comprehend and they can't make sense out of many noises at one time. So as a result, they often become more agitated when around many noises. So a mixture of sensory stimulating and sensory calming may help when we're dealing with unwanted behaviors. We also have a way of reducing environmental stressors, and one way to do that is eliminate caffeine from a person with dementia's diet. We can also reduce unneeded noises and extra people in a room, and this is particularly true when a person with dementia must focus on a specific task, if they're trying to complete tying their shoes or buttoning their blouse. Other things to consider are to create a safe environment. We're always looking at identifying, put locks on doors and disguise hazardous areas. And the doors would be an exit from a facility as well as perhaps a janitor's closet in the hallway that holds chemicals. And a way to do that is not only by locking those doors, but you could also disguise them. Instead of it being an exit, it could be anything else. It could be disguised as a bookcase. It could have, you could use your imagination and use material or colored paper to create a number of different visual effects for the person with dementia. anything but what in fact that door is. Contrasting colors are also very helpful for a person with dementia due to the fact that visual spatial deficits begin to exhibit as the disease progresses. For example, if you have a white tablecloth, a white plate with mashed potatoes on it, it is, even for us, very difficult to see that it is food and that it's something appetizing for us to eat. Also, using simple signs that can aid with cueing, and this can also reduce wandering. Very often when a person wanders, they may be looking for the restroom. So if you have a restroom area, you could place a picture of a toilet and perhaps the word toilet on the door, which will then help that person find the restroom on their own. And this is also important for them to do independent wayfinding. They don't need assistance from someone to help them find that restroom. Personal items should be prominently displayed to help with wayfinding. For example, if a person is looking for their room, which happens very often at facilities when rooms they look very similar. Each opening is the same and they're on the same hall. Very often people will have shadow boxes on the outside of their rooms with familiar items such as pictures of themselves so they can identify that this is their room, or familiar items, personal items that they cherish that they and only they can recognize. They will then, in their minds, know that this is the room where they belong. Reducing glare on surfaces, especially floors, is also very important. If you can't see where you're going and you are also confused and disoriented, it is a safety condition as well. Familiar odors, such as coffee brewing, can enhance appetite, and it can also foster independent wayfinding. If coffee is brewing and there's a smell of cinnamon toast, for example, that could signal to a great many people that it is breakfast time as opposed to dinner time. If someone can accomplish something on their own, they feel successful, they are happy, and this reduces their stress.
So, how do we get to the bottom of these behaviors? How are we going to become a successful caregiver in the face of all these challenges? Well, first of all, we have to center ourselves, and I often think of this as being a disciple of Sherlock Holmes. We have to look at this as a puzzle. We have to think about how we can become a detective and get the facts we need to care for our patients. We have to become very clear about what the behavior is and how we can deal with it. So the first thing we need to do is stop and question the behavior when it's observed. Look for clues about what is going on and why. And when we take a look at the clues around the person, but also look at the clues in the environment in which the person is functioning. And look for clues on yourself. Because sometimes persons with dementia react to us, even though we may care for them every day, in a way that indicates they have forgotten or misplaced who we are. Constant reassurance is very necessary in working with patients with dementia. Listen and talk to others who work with these individuals and other persons with dementia or other residents or patients, because they may be able to give you clues about the behavior. Look at each problem as a separate challenge. Sometimes behavior can be so overwhelming that we forget that we must look at each separately if we're going to devise an approach for each behavior. First of all, ask, is it safe? Secondly, and probably in combination with safety, is it dangerous to this person or to anyone else in the environment? Is this behavior realistic? Sometimes behavior